Hi there, Dr. Ashley Oxner with Health From Within. Wanted to talk to you guys today about back pain in pregnancy. One of the most common issues that expectant mothers do deal with is back pain, especially lower back pain. So I wanted to kind of talk through how we safely and effectively address that in the chiropractic setting today. We've got our wonderful model Teresa who's going to help me show you guys how that works today. So to start with, one of the things I wanted to feature and point out is we have some pretty amazing pillows that our expectant moms always try to steal and take home with them. And these are our pregnancy pillows. As you can see, they have a cutout in the middle so that when the mother has to go on her stomach for any part of the evaluation, she can comfortably do so for that short amount of time, perfectly safely, comfortably. Really helps us with the evaluation, as you're going to see. I also have our table, which can also change in how it is positioned. We can maneuver this table into different positions to allow for baby to be right here, uncompressed and very, very safely taken care of while we take care of the mother. So just a couple things I wanted to let you know that we've got you covered. I'm going to talk about equipment and approach and technique. So what I'm going to do is actually have Teresa lay on her stomach here. We're going to go face down for her evaluation and checkup and adjustment. What we do then is, as you can tell, she's up in the air a little more because of the pillows, so we raise that headpiece up. She's comfortably on her stomach. Now the analysis that we do for a pregnant woman is a little bit different than what we would do if you weren't expecting. There's some changes that happen in the hormones into the hip joints, especially something called relaxin is really high, so those hip joints are very mobile, and that can cause kind of an unstable situation. So we want to make certain that we assess the SI joints, sacrum, lumbar spine, and pelvis so that the baby can have the optimal position for birth when that magical day comes. So what we'll do first here is something that's just called a leg check. So we're going to come around, we're going to bend the knees up like so, and as I kind of pump the legs a few times, that resets that lower back and pelvis. Bring it back down, and I want to see if anything's off. She has this left side that's actually contracted up, showing up shorter. We'll be addressing that momentarily. Going to palpate to see where there's any issues. She's got this hip subluxated as well as this one here. Is it tender on the left?
Yeah.
How about the right?
Worse.
So in her case, she's got kind of a twofold issue. So we're going to do a drop adjustment on her left hip. This table's going to jump up. I'm going to contact here. It's going to come down. Just like so. Handle that. Also get the sacrum. And then her other side here, we're going to do that one while she's laying on her side momentarily. Not to ignore the rest of the spine. The expectant mom who never has stress, right? No stress whatsoever, can definitely manifest up here. So she's definitely got some couple of rib heads and thoracic subluxations. Will set beautiful. One more time here. Good. That worked perfect. All right, let's go ahead and come up. We're going to lay on your left side. So when we're adjusting side posture, it's very critical with an expectant mother that we're super specific, very gentle in this approach. So what you're going to notice here is we've got her leg up but not completely cranked up, so there's plenty of room for baby. I'm going to roll to the side. I'm just going to contact that hip right here in that lower back and just add a little pressure. One more. There it went. Just like that. Go ahead and lay on your back. Perfect. So that, my friends, is how we do an adjustment of the expectant mother. A couple things I'll mention too. Sometimes when we do meet expectant moms, the baby's already in kind of an abnormal position. They've got a malposition, whether they're breech or transverse. There are some techniques that we have for that from a soft tissue perspective and the adjustment with what we call a Webster analysis. So if you know anybody who's having some issues with where the baby's positioned, we can address that as well. But specific to this video, back pain, this adjustment for expectant moms does wonders. So I encourage you, if you are expecting and you have back pain or know someone who is, do fill out the information. We'll get a hold of you, or you can call us. Come on in for that evaluation, and we'll see if an adjustment's right for you. Thanks.